You know that feeling, right? When your hands just get freezing cold. But what if for some people, it's way more than just being a little chilly? What if fingers turning white is actually the first clue in a much bigger medical mystery? Well, today, we're going to pull back the curtain and see what's really going on. So let's start with a really common scenario. We've got a 22-year-old woman, and whenever she gets cold, her fingers do this wild color-changing thing. Sounds kind of weird, sure, but it doesn't hurt, and she feels fine otherwise. This is the kind of thing doctors see all the time, and it usually doesn't set off any major alarm bells. But then, you have this, a totally different story. A 48-year-old woman, and yeah, her fingers change color too, but her experience is worlds apart. We're talking about painful sores, skin that feels tight. These are signs that something much more serious is brewing just beneath the surface. And here's the puzzle, right? Both of these women get told they have Raynaud's. So how can one person's experience be a minor annoyance while the other's is a sign of a major health issue? What gives? That's exactly the mystery we're going to solve. Okay, so to crack this code, we have to get our terms straight first. The entire secret is buried in the difference between a phenomenon, a disease, and a syndrome. Believe it or not, the name is going to tell us pretty much everything. Let's kick things off with the big one, Raynaud's phenomenon. The best way to think about this is as an umbrella term. It's simply the description of what's happening. Those little arteries in your fingers are spasming and clamping down. The most important thing to get here is that this is just a sign, a symptom. It is not the final diagnosis. And from that one sign, the road splits in two. On one path, you've got primary Raynaud's, that's what we call the disease. And on the other path, you've got secondary Raynaud's, which is the syndrome. Seriously, understanding this fork in the road is the key to the whole thing. And look at this. It lays out two completely different profiles. The disease usually starts when you're young, under 30. It's mild, you don't get ulcers. Sound familiar? That's our 22-year-old, to a T. But the syndrome, that tends to show up later, it's way more severe, and can actually cause damage, just like our 48-year-old. The difference is just night and day. All right, so we know the names now, but why is this happening? Let's pop the hood and take a look at the engine room, the blood vessels themselves, to see what's actually driving this. It all boils down to this right here. With primary Raynaud's, the problem is functional. Your blood vessels are perfectly healthy, they just overreact to the cold. They're a little dramatic. But with secondary Raynaud's, the problem is structural. The blood vessels are actually damaged, and then on top of that, they spasm. It's a double whammy. So you might be wondering, what's causing that structural damage? Well, 9 times out of 10, it's because of some other underlying condition. The biggest culprits are connective tissue diseases, things like systemic sclerosis. But it could also be from something like clogged arteries or even some medications. This is exactly why getting it right matters so much. Sometimes the severe form of Raynaud's is the very first clue that something else, something bigger, is going on in the body. Okay, so with two such different things going on, how do you spot the difference? Well, it all comes down to playing detective and looking for some very specific red flags in the symptoms. First, let's talk about the one thing that unites both types, that classic 3-step color change. First, the fingers go white because the blood flow is just cut off. Then they turn blue as the blood that's trapped in there runs out of oxygen. And finally, they flush bright red as the blood comes rushing back in. That right there, that's the phenomenon. But this is where the stories really split. The benign disease usually happens in both hands at the same time. It's symmetric, and the pain is pretty mild. The syndrome, on the other hand, can be asymmetric, it hurts a lot more, and, this is the big one, it can lead to these major red flags, sores, little pitted scars on the fingertips, or even worse. Those are the signs you just can't ignore. So we've got the clues, we know what to look for, now what do we do about it? Let's talk about how doctors reach a verdict, and more importantly, what the action plan looks like. So while the patient's story tells you a ton, there's one test that's pretty much the gold standard for telling these two apart, nail fold capillaroscopy. It sounds super complicated, but it's actually incredibly simple. A doctor just uses a microscope to look at the tiny little blood vessels at the base of your fingernail. If they look normal and healthy, that points to the primary disease. If they're all distorted and damaged, well, that points to the secondary syndrome. Now, here's the thing. No matter which diagnosis you get, the management plan starts in the exact same place for everybody. It's all practical, common sense stuff. Stay out of the cold, wear good gloves and warm socks, stop smoking, and try to manage your stress. This is always, always square one. Now, if that lifestyle stuff isn't cutting it, then you can move on to medication. Step one is usually a type of drug called a calcium channel blocker, which just helps the blood vessels relax a bit. But for the really severe cases, especially in that secondary syndrome, doctors have to pull out the bigger guns, more potent drugs, to protect the tissue from getting damaged. So let's just put it all together one last time. Raynaud's disease, we don't know the cause, the vessels are fine, it's mild, and the outlook is fantastic. Raynaud's syndrome, it's caused by something else, the vessels are damaged, it can be severe, and the outlook really just depends on what that underlying cause is. See? Two totally different stories sharing the same name. And that brings us to the one single idea that perfectly wraps this all up. If your fingers change color, you have the phenomenon. But, and this is the key, you only have the disease if it's the benign kind with no underlying cause. Understanding that one little distinction, well, that's how you solve the hidden story behind cold hands.